So today we have lesson 2, cardiac emergencies and giving CPR. First, we got to talk about heart attacks. A heart attack occurs when the blood flow to part of the heart muscle is blocked, causing cells to die and leading to permanent damage of the heart muscle. Seeking advanced medical care as soon as the signs and symptoms of a heart attack are recognized minimizes damage to the heart and may save the person's life.
Being able to recognize when a person is having a heart attack can be a life-saving skill. Signs and symptoms of a heart attack vary from person to person and can be different in women than they are in men. Even people who have had a heart attack before may not have the same signs and symptoms with a second heart attack. Chest pain, pressure, and discomfort are the classic signs of a heart attack. The pain can range from mild to unbearable. The person might describe the pain as tightening, squeezing, or severe pressure. The pain may last longer than 3 to 5 minutes or go away and then come back. Although the pain may feel similar to that of a muscle spasm or indigestion, resting or taking medication does not relieve the pain. The pain may spread to one or both arms, the back, the upper part of the stomach, or the neck and jaw. The person's appearance and behavior may also offer clues. The person's skin may look pale or slightly grayish or bluish, and the person may be sweating heavily. The person may be having trouble breathing and feel short of breath. Some people become dizzy or lightheaded, or feel nauseous or vomit. Others may become unresponsive. Many people who have had a heart attack say that they felt anxious, like something really bad was happening. Others describe feeling unusually tired for a period of time leading up to the heart attack. Trust your instincts and seek advanced medical care immediately when you recognize the signs and symptoms of a heart attack.
All right, as mentioned in the video, some signs and symptoms of a heart attack are chest pain, discomfort, pressure, squeezing that lasts longer than 3 to 5 minutes and is not relieved by resting, changing position, or taking medication, or that goes away and then comes back. Discomfort or pain that spreads to one or both arms, the back, the shoulder, the neck, the jaw, or the upper part of the stomach. Dizziness or lightheadedness, trouble breathing, including noisy breathing, shortness of breath, and breathing that is faster than normal, nausea or vomiting, pale or ashen gray skin, sweating, a feeling of anxiety or impending doom, extreme fatigue, and unresponsiveness. So there are many different signs and symptoms, but everyone's not going to experience all those different signs and symptoms. That's what makes or diagnosing a heart attack difficult. Even people who have had a heart attack once in their life and then have had a second heart attack have experienced different signs and symptoms. So men often have classic signs and symptoms of a heart attack, such as chest pain that radiates down one arm, while women often experience milder chest pain or general signs and symptoms such as shortness of breath, nausea, and vomiting, extreme fatigue, dizziness, or lightheadedness. Now, what's our role? If you think a person's having a heart attack, we need to call 911 immediately. Then get prepared for CPR and get an AED if one is available. Help the person rest in a comfortable position. If they have tight, restricting clothing on around their neck, loosen that up. You can get them some medication. If the person has heart medication, you can give them some ibuprofen as long as they can swallow. And rest assured that the person, that the EMS is going to arrive soon and that they'll be okay. Trying to get them as comfortable as possible. But do be ready for CPR because they could go into cardiac arrest. So cardiac arrest and heart attacks are two different things. So cardiac arrest frequently happens suddenly without any signs or symptoms. Causes of cardiac arrest can include heart disease, which is cardiovascular disease, severe trauma, some breathing emergencies, could be drowning, could be an allergy, could be an asthma attack, electric shock, and drug overdose. In children and infants, the most common cause of cardiac arrest are breathing emergencies, chest trauma, and congenital heart disease. Although a heart attack can lead to cardiac arrest, they are two different conditions. A person in cardiac arrest is non-responsive, not breathing, and they have no heartbeat. Cardiac arrest and the cardiac chain of survival.
When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. There is a cardiac chain of survival for adults and one for children and infants. Let's look at the adult cardiac chain of survival first. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services (EMS) system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. The pediatric cardiac chain of survival is slightly different from the adult cardiac chain of survival. Because cardiac arrest in children often occurs as the result of a preventable injury, such as trauma, drowning, choking, or electrocution, prevention is the first link in the pediatric cardiac chain of survival. The second link is early CPR, and the third link is activation of the EMS system. Just as in the cardiac chain of survival for adults, the fourth and fifth links are early advanced life support and integrated post-cardiac arrest care. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR and using an AED as soon as possible, you can make the difference between life and death for an adult, child, or infant in cardiac arrest.
All right, giving CPR.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest.
So you should use interlace your fingers. The heel of your hand should be right in the center of the chest, in the center of the breastbone. And as notice,
Position your body so that your shoulders are directly over your hands.
how his shoulders are directly over his hands and his elbows are locked out. This will help with fatigue, as you're going to have to do a lot of compressions when given CPR.
With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions.
1 and
Keeping
2
your
and
arms
3
straight,
and 4
push
and
down
5
at
and 6
least
and
2
7
inches,
and 8
then
and
let the
9
chest
and
return
10
to
and
its
11
normal
and 12,
position.
13,
Continue to
14,
push
15,
hard
16,
and fast,
17,
giving
18,
compressions
19,
at a
20,
rate of
21,
between
22,
100 and
24,
120
25,
compressions
26,
per minute.
27, 28, 29, 30. 1
For a
and 2
child,
and 3
push
and
down
4
about
and
2
5
inches.
and 6 and
And
7
for a
and 8
smaller
and
child,
9 and
you may
10 and
only
11
need to
and
perform
12,
chest
13,
compressions
14,
with one
15,
hand.
16, 17.
Notice he only needs to use one hand. That again depends on the size of you and how strong you are versus the size of the individual that needs CPR. So if it's a larger individual, you should use both hands as shown in the first video. If it's a much smaller individual, then you might only need to use the one arm, because we don't obviously want to crush the individual.
18, 19.
Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a pass-neutral position. For a child, you'll only need to tilt the head to a slightly pass-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
Again, just to reiterate, you blow in for about 1 second and until you see the chest clearly rise. So again, the size of the individual will determine how much force you need to blow. If it's a much smaller individual, then you might not need as much force versus a larger individual who has larger lung capacity. So the rule is blow in for 1 second until the chest clearly rises. A cycle of CPR is 30 chest compressions with 2 breaths, and then 30 chest compressions with 2 breaths. So that's what a cycle is, 30 and 2. And your goal is to try to get 100 to 120 compressions in 1 minute. So you need to move fast.
Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have performed 5 sets of CPR on a child. You are alone and need to call 911.
17, 18, 19, 20, 21, 22, 23, 24.
EMS personnel take over.
28, 29, 30.
You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2.
Have the AED and first aid kit.
Okay, just a couple reminders. You continue CPR, again, until you become too tired to continue. The scene becomes unsafe. You have revived the individual, and they are now up and they're breathing again on their own. Another trained personnel or EMS arrive on the scene to help out.